the government still maintains its target to vaccinate over 10 million adults by December 25th, while calling on Kenyans to up their vigilance on getting vaccinated, as well as stakeholders to equip medical facilities with proper protective and treatment equipment, paying more focus within the counties while targeting those in vulnerable situations ahead of the global threat. Gertrude Burgay brings us that report.
While no case of the new COVID-19 variant Omicron has been detected in Kenya, stakeholders are worried that the country is not ready to face its spread if it made landfall if what is happening internationally is anything to go by.
The country is not fit or in the situation to handle the pandemics the way it has not been able to handle the previous one. So there's need for the government to actually employ more healthcare workers and employ more doctors. As we have said, we have more than 3,000 doctors who graduated and have not been employed. And when you look at our WHO ratio of doctor to patient is 1 to 16,000 instead of the recommended 1 to 1,000.
With a rise in case of those testing positive for the new variant, preliminary evidence suggests there may be an increased risk of reinfection with Omicron as compared to other variants. While commending Kenyans for the collective efforts to fight this invisible enemy, President Uhuru Kenyatta warned the war against the mutating COVID-19 is not over and every adult should get vaccinated.
Indeed, after much reflection, we opted for the public health argument over the economic argument. Our rationale was that you can always revive an ailing economy, but we cannot bring to life those who die from the pandemic. And with this logic informing our choices, we set out to build the irreducible minimums recommended by the experts to forestall a COVID disaster.
KMPDU maintains the need for vaccine education to increase the uptake of available vaccines as well as increasing the vaccination points to places of service delivery.
People always tend to have misconceptions when they don't understand. And especially when you force them, than when you don't make them to understand the reason and the needs for the same. And as we'll tell you, in the medical practice, you must know and you must accept the treatment for them to be effective in many scenarios.
So far, slightly over 7 million adults have been partially vaccinated against COVID-19 in Kenya, with 10% of the adult population being fully vaccinated. This is against a target of having 10 million Kenyans vaccinated against COVID-19 by Christmas. According to WHO, current COVID-19 vaccines remain critical to reduce severe cases and death. Gertrude Burgay, NTV.